I now have the privilege of introducing i-Lumen Scientific. i-Lumen Scientific is an ophthalmology-based company that has pioneered the use of neurostimulation applied to the surface of the eyelid to stimulating retinal cells to improve central field of vision and slow the progression of cellular atrophy. Please welcome John VeLure, CEO and President of i-Lumen Scientific.
Thank you. Imagine losing your central field of vision. 1 in 4 people over the age of 60 have difficulty seeing the face of their spouse, children, and grandchildren. Dry, age-related macular degeneration is the leading cause of blindness in those over the age of 50. It's a progressive disease that affects the central field of vision, and patients become symptomatic by age 60. Now imagine going into your physician and only being able to read the purple line. But if your physician had a treatment for you that within 5 days you could actually read the green line and you had a 15-letter improvement, think about the positive outcomes that could come from this. The ability to read, maintain your license, as well as walk without assistance. We've developed a surface neurostimulation technology to improve the central field of vision and to slow the progression of geographic atrophy. Now, dry AMD is a huge market. Today, there are 11 million people just in the US that suffer from this disease. And it's potentially a $14 billion market if we only penetrate 40% of the market. Compare this to the wet AMD, which has treatment solutions today, and it's a $5 billion market, and they're treating less than 2 million patients. Huge market opportunity in the US. Our low-level neurostimulation activates specific cells within the retina. We have a 5-day treatment regimen, and more than 53% of patients see a 15-letter improvement in visual acuity within 5 days. Now, we have significant clinical validation for our technology. Not only do we have a human clinical study where we treated 539 eyes, but there are several preclinical or animal studies along with computational modeling to be able to demonstrate where the current is going within the eye and the amount of current that's being delivered to each of the cells. Our focus is repair and regeneration of the photoreceptor cells. More specifically, delivering energy to the retinal pigment epithelium and the Mueller cells, which are designed to help improve vision and slow geographic atrophy. Now, our strategy is to exit via acquisition prior to commercialization. Before that, we will complete 2 clinical studies, a pilot and pivotal. We're looking to raise in this round $3.5 million, and we're looking to exit in late 2024 via an acquisition by a strategic ophthalmology company. Now, we've already initiated conversations with these strategics in the marketplace, and we understand the recent industry acquisitions and the valuations that these companies have generated, and they're all pre-revenue. Now, we have a strong management team. Not only have we cleared 16 devices through the FDA, but we've been responsible for 5 acquisitions that have led to an acquisition value of over $850 million. We're also included with leading luminaries who have helped guide the development of our technology, including Dr. Sophie Bakri, who is chair of ophthalmology at the Mayo Clinic, as well as Robert Warner, who is a former president of the Americas for Alcon. Now, we're looking to close on $1.5 million to close out our $3.5 million Series A round. We've already raised $2 million. We have a strong investment scenario. 15-letter improvement in visual acuity within just 5 days, a human study that has data that signals the viability of our technology. We're expecting to be acquired prior to commercialization, and we are projecting a return of 8 to 10x for our investors. Thank you, and I look forward to seeing you in the breakout rooms.